One person dies of suicide every 8 hours in our state of Indiana, according to IU Health.
Yeah, the hospital network is rolling out $1 million initiative to curb that rate. News 8's Aaliyah Hodges has more in today's Inside Story.
IU Health says the suicide rate has increased by 35% since 2001. They received a grant from the Federal Substance Abuse and Mental Health Services Administration to implement the Zero Suicide Initiative. The Zero Suicide Initiative is now implemented at all 15 hospitals within IU Health. This allows not only behavioral health experts, but emergency departments and primary care doctors to screen for suicidal risk. Everyone working together to prevent suicide.
It is the #1 cause of death in 18 to 25-year-olds and the second highest cause of death in children from 10 to 18.
Healthcare professionals will use evidence-based models with a high success rate of minimizing suicidal thoughts. It starts by asking a series of questions.
For example, are there times that you wish you wouldn't wake up in the morning? The second question that goes on from that are, have you wished you were dead? And then it goes on from, have you actually thought about ending your life? Have you made plans of ending your life? Have you tried to end your life in the past?
It also includes enhanced support services for people who screen high for suicide, like Caring Contacts. It's a text messaging service that provides discharged patients with encouraging messages and follow-up communication. Therapists and ER doctors will also collaborate on a safety plan if suicidal thoughts reappear for discharged patients. It'll provide therapy sessions until patients are able to access long-term outpatient behavioral health services.
Everyone in the healthcare system needs to be educated about suicide, how to screen for it, what to do if you identify, and how to sort of judge if a person needs immediate care or if we can assist them getting into gradual care.
The Zero Suicide Initiative will be a phased-in approach, as there will be training, new technology, and therapists. Also, ways to educate people beyond the healthcare system.
If we can educate the public about how to identify people that might be thinking of suicide and how to get them into treatment, actually that can save more lives than CPR.
Between the high demand for mental health services and the bureaucracy between Medicare and Medicaid, how can the state of Indiana better fund health care and make it accessible for all? That's tomorrow in the last part of this series. Reporting, I'm Aaliyah Hodges for WishTV, wishtv.com, and follow us on Facebook.